I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida with the Whitford Thomas Group. Today I'm going to speak to you today about the symptoms of manic depression. Manic depression, commonly known as bipolar, or years ago, manic depression is a mood disorder. It has two components, mania as well as depression. So let's look at mania first. Mania is an elevated mood. And so in this elevated mood, you oftentimes see kind of a increased self-esteem as far as kind of an unrealistic self-esteem and grandiosity. Oftentimes in mania, you see people with mania, elevated mood, tend to have a high energy level. Unfortunately, with a high energy level, oftentimes with people with mania tend to have some poor boundaries. Other things associated with mania would be you don't need a lot of sleep. Another component of mania tends to be an increased tendency to engage in kind of high-risk activities, oftentimes sexual discretions, drinking or drugging, shopping sprees. Oftentimes with the mania, you see this kind of pressured speech. Oftentimes people who are in a manic state, it's almost like they can't get the words out of their mouth fast enough. On the depressed side, the signs and symptoms we tend to see is because depression from a thinking side tends to be a sense of hopelessness or helplessness. And so what people with depression, oftentimes what you see is that a lack of motivation, a poor self-concept or self-acceptance, low energy level, fatigue, oftentimes poor concentration, sleeping disorders, oftentimes people have difficulty in appetite, are the typical type of depressed symptoms. So manic depression has both pieces, mood disorder, you have mania as well as depression. I'm Dr. David Thomas, speaking today about the symptoms and signs of manic depression.